Welcome to Your Family's Health. This is Joan Buckley from the Department of Nursing here at Nassau Community College. Your Family's Health is a program that focuses on the healthcare issues and the resources that are available to you here in Nassau County. On the show, we speak to experts from around the country to keep you up to date on current healthcare issues and trends. And today we're going to be speaking to Dr. Sanda Moldovan. She is a lot of things. She's a periodontist, she's a nutritionist, she's an expert on oral health and wellness, but she also is an author and has a new book coming out this fall, 2018, called Heal Up, 7 Ways to Faster Healing and Optimum Health. So if you want to know more about how to stay healthy in Nassau County, stay tuned for the next half hour to the Voice of Nassau Community College 90.3 WHPC. Welcome to the show, Dr. Sanda.
Thank you, Joan, for having me. It's a pleasure.
Well, we're really glad you're here because we're always trying to give our community as much information as we can to stay healthy. And this is like a perfect topic for everybody, especially since all the kids will be going to, the dentist over the summer. You're like a really nice segue into the summer session.
Absolutely.
But actually,
we've had so many changes in dentistry, Joan. It's exciting. It's not the old, being scared because it's going to be painful. We have so many more treatments today that are more pleasant than in the past.
How did you get into dentistry and periodontal work and that? How did that occur? Because I'm sure you started out with maybe a couple of goals and paths to follow when you chose this one, which, as you said, traditionally is known as, the dentist. Nobody
exactly who's a dentist.
Mm-hmm.
And to tell you the truth, when I grew up, I hated going to the dentist because I grew up in Romania and we really had no dental anesthetic. So I had lots of fillings in my childhood because I had such a sweet tooth, and they were done with no numbing. So it was quite painful. And here I am now. I'm a dentist, and I must say I love it because it incorporates a lot of the biological healing, and there's such a connection between oral health and overall health, and I get to see really people smiling and make them achieve their health goals. So it's exciting.
Now, do you usually see people that are referred from their practitioners, like perhaps they are having a physical ailment and the physician or the NP or the PA, whoever they're seeing, the provider, actually identifies something in their mouth? Now, there's lots of parts of your mouth, but with dentistry, you think of teeth. But is that ever an issue where you get a referral from someone that has an issue and their general doctor says, you need to see the dentist?
Yes, Joan, and it's very exciting. Actually, today we get more referrals from physicians, especially our office, because we are a biological dental office. And are you familiar with biological dentistry?
No, I just wrote that note down to ask you, what is biological dentistry?
So biological dentistry is really looking at the body as a whole. So a lot of physicians that I work with, medical doctors, chiropractors, they check everything. And actually physicians today are looking in the mouth because the mouth is the number one source of infection. Why? Because we get crowns and fillings and maybe partial dentures, and those can harbor infections that can affect the rest of the body. So typically these physicians, which can be functional medicine or integrative medicine, they will actually look in the mouth, ask how many root canals do you have, if you have crowns, and if you've seen a dentist, and they make the recommendation to see me. The other reason why they would send somebody to me is because they test stool samples and they find gum disease bacteria in the stool, and then they automatically will refer those patients to me since I'm a periodontist, so we can address the mouth as well, because the mouth is really the opening of the gastrointestinal tract, so we can't ignore it.
I've been around for a while, but I've never heard about the gum disease and the relationship with stool specimens. Is that fairly new, or is that something that just came out of almost like an accidental finding? Like, how did that occur? I mean, I know it starts in the mouth and it ends at the rectum. And same tissue, same everything. So it makes total sense, but I honestly never really heard that before.
Yes, Joan, because what's happening really in the last decades, physicians were completely separate from dentists. Yeah. So we thought, okay, here's the mouth and here's the rest of the body. And we never made that connection. And that's been one of my missions in the last 15 years I've been a practicing dentist, to really get the physicians and the dentist to communicate more so we can better help heal certain conditions. So we've had a lot of research in the last, I would say, 8 years about the oral microbiome, and basically what encompasses the bacteria in the mouth. We call it the biofilm. The biofilm is a layer of bacteria, could be also some parasites that are living inside the mouth, inside the intestines and the stomach. So this lining of the bacteria has to be healthy. We can't live without bacteria. We can't have a sterile mouth because we actually will have a lot of diseases. But if we have bad layer of this bacteria or a bad biofilm, pathogenic biofilm, then we will see oral diseases as well as intestinal problems.
So what is considered an oral disease? It's not necessarily just tooth decay.
Right. Oral disease or comes from usually an imbalance. So oral disease can be cavities, as you mentioned, because cavities is actually an imbalance in bacteria. There's a bacteria that causes cavities. But gum disease is a result of inflammation. And usually the mouth, I look at it as a gateway to one's health. When I look in somebody's mouth, I see their overall health. If somebody's overall health is great and their diet is good, their lifestyle is good, the mouth looks great. There's no grinding or clenching from stress. The gums are pristine with no bleeding. There's no cavities. But if somebody's lifestyle, for example, causes inflammation in their body, so eating processed foods, for example, will cause inflammation in the whole body, and we see that in the mouth as well.
How about stress? Is stress a factor for the, setting someone up for inflammation issues?
Absolutely. Stress, how does it manifest in the mouth is really as grinding and clenching. So when we're more stressed, even sometimes, even I catch myself sometimes, even at work, when I just, clench the jaw, and that could be dangerous for the teeth. We'd start seeing wear. People can break teeth or just part of the tooth off. So stress management is very important, not just for the whole body, but also for the mouth.
So if someone's referred to you because the stool specimen that was taken in the primary's office showed the potential or possible or real inflammation in the gums, and they come to you, what is the first thing? What should they expect to see happen within your office? And I'm assuming there's a team, because you mentioned that you like the idea of being connected. What would they expect from their first visit with you, being referred by a primary doctor?
That's a great question, and I'm very lucky to work with amazing teams in LA, in Beverly Hills, and New York City. Actually, we have our office in Tribeca, Tribeca Advanced Dentistry.
Nice.
And my colleague, Dr. Olga Malkin, is a prosthodontist, and she and I work together there to ensure the overall health. So what we would do first is do a saliva test. If somebody comes referred saying, okay, the stool showed periodontal disease or periodontal pathogens, bacteria, then we will do a saliva test. And we're lucky today because microbiological testing is really good and inexpensive. So what we do is a saliva swish. We have you swish with some saline, spit it in a test tube, and then send it out to a lab. And within 5 days, we get a result to see what kind of pathogens are in the mouth. Usually we see a correlation between the stool and the saliva. One of the bacteria that's been in the news today is called Fusobacterium. And Fusobacterium has been linked to periodontal disease for decades. But recently we're finding it in colorectal cancer. And we don't know exactly if it causes the cancer or if it just latches onto the cancer cells and make them exponentially grow. We're not exactly sure of that relationship, but I'm sure in the next 5 years we will know a lot more about how this bacteria from the mouth ends up affecting our overall health.
I've honestly, and I really do think about my health and my family's health. I'm really very grateful to have the opportunity to talk to you. I've never thought of it this way. And that's so nice to know that I can still learn things. So for the listening audience to hear this now, I think this is a real eye-opener that the mouth
glad.
is, and I love the idea of the mouth, the gateway to a person's health and well-being. And I have heard that before, that you look in the mouth. I just have a hard time looking in mouths. What are you looking for when you look in a mouth as far as health?
That's a good question. And actually I have a YouTube channel, Ask Dr. Sanda, and I just had posted a oral exam, a self-oral exam that people can do at home.
Oh, well, that
is
really good.
And what to look for.
On YouTube.
Yeah. Because some people, maybe they don't have dental insurance and they haven't been to the dentist in years, either because they're afraid or they haven't had the time for it. So I highly encourage you to do an oral self-exam. Look in the mirror. Look at the color of the tongue. If it has a whitish coating, usually that indicates digestive issues. Look at the cheeks for any kind of abnormal coloring. So usually everything should be nice and pink. Any kind of spots that are reddish or for a long period of time, those are signs that you should go visit professional dentist to make sure that they look and evaluate those farther. Also, we should be looking for bleeding gums and spots on the teeth, like black spots. Those usually indicate cavities.
You're pointing out things that people know in other areas, but I don't know that they thought of their mouth, because with breast self-exam, it's kind of the same thing. You need to know your body. And I honestly, I'm not that young. I have not sat there or looked at my mouth at all. I totally just do my teeth the same way all the time, do what the hygienist says. She comes up with new techniques sometimes, and I try to do them, and floss and all those things. But I do it blindly. I don't look really at my face at all, but that is key to know your mouth.
Absolutely, Joan. And it's the one spot we can look inside our body.
Oh, that's
because everywhere else we can't see, but we can really see the inside lining of the mucosa. And also the back of the throat is important to check for that, because throat cancer really can occur without somebody even knowing that they have it. So as long as we look for spots or abnormal discoloring, then we can do something about it.
This is really an eye-opening interview. So I think right now, it's a perfect time for a break. And you're listening to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC. This is Joan Buckley and Dr. Sanda, and we're going to continue talking about oral health.
1 in 3 adults in America have prediabetes, but most don't know it. To let people know it can be reversed before it becomes type 2 diabetes, professional basketball player Julius Randle is doing everything in reverse.
I'm only dunking with reverse windmills. I drove the whole way to practice in reverse. I don't recommend it. This move's called the reverse shuffle. I do recommend it. And it took me months to learn how to speak in reverse, like this. Years 10 almost for diabetes type 2 with living Ben has mama. In other words, my mom has been living with type 2 diabetes for almost 10 years. So together, we want to say to the 84 million Americans at risk, exercise and healthy eating can help reverse prediabetes. Start by taking a simple 1-minute risk test at doihaveprediabetes.org.
Brought to you by the Ad Council and its Prediabetes Awareness Partners.
90.3
WHPC. Welcome back to Your Family's Health. This is Joan Buckley, and we welcome back our guest, Dr. Sanda. Now, Dr. Sanda, before the break, we were talking about oral health. Now, that's part of you. And now this author piece. Now, your new book, it's coming out in the fall, Heal Up, 7 Ways to Faster Healing and Optimal Health. It makes total sense. Just the way you describe the connection between the mouth as it goes through the digestive tract and all of those things. And so tell me a little bit, like, how did this occur? Like, you've been practicing 15 years. When did you decide that you really needed to put this in writing and really spread the word?
So, Joan, about 6 years ago, I started going more and more to medical conferences, and I realized that even our medical professionals don't even know, outside of dentists, how the mouth even is or the problems that we're encountering. So 6 years ago, I started putting down information, and I said, okay, I'm going to write a book in which this book is, by the way, written for patients, because a lot of people also ask me, well, how do I heal better? I have this gum disease. Is there a pill I can take to heal? And, unfortunately, there's no magic pill.
Oh, I was going to say, is there a pill? No pill.
No, there's no magic pill. It really comes, number